Hello. This is Tokyo Anesthesiology Clinic. This is Special Edition, Episode 4. In the previous episode, we talked about suffering beneath chronic pain. We discussed spiritual pain and social pain. This time, we will talk a little more about what happens in clinical treatment. Even with the same ketamine, the way it takes hold and the sense of response can differ from person to person. Why do these differences happen? One possible background factor may be the condition a person is in before treatment begins. Today, we will ask our director, Dr. Tori, about this way of thinking. This video provides medical information for a general audience. We do not provide individual diagnoses or treatment advice. If you have symptoms, please seek evaluation at a medical institution. In an emergency, please use emergency medical services. This video uses the director's AI avatar, synthetic voice, and synthetic video. The content is supervised by the director.
Hello, I am Dr. Tori, the director. First, I will state the conclusion. Ketamine is not a treatment where the same medication always works in exactly the same way just because the same drug is given. What matters is not only the dose, it also matters what condition the person is when treatment begins. At our clinic, we have observed not only ketamine alone, but also several approaches related to pain and the autonomic nervous system. Through that experience, we have come to think that when the condition before treatment is different, the way ketamine takes hold and the sense of response may also change. However, today is not an episode where we make a definite conclusion. What have we begun to see? Why might this be? That is what I will talk about today.
Doctor, what you are saying here is not that you want to recommend some special procedure, is that correct?
Yes, that point is important. What I want to talk about today is not the name of a specific procedure. It is the way of thinking about why differences may appear. Originally, among methods used clinically for pain and the autonomic nervous system, some approaches are related to sympathetic nervous system tension and imbalance in the autonomic nervous system. At our clinic, as we observed these factors together, we began to feel that when autonomic nervous system tension is somewhat regulated beforehand, ketamine may sometimes seem to take hold more easily.
So it may not be only a matter of medication dose, is that the idea?
Yes, that is the core point today. Ketamine treatment is not simply a matter of increasing the dose. Even with the same dose, there are times when it takes hold more easily and times when it does not. That difference may be related to the autonomic nervous system and emotional tension. That is how I think about it.
Why would the autonomic nervous system be related? That is the part many people may wonder most about.
The key is a state where the body is too strongly in alert mode, strong anxiety, the body feels tense all the time, difficulty sleeping, palpitations, shortness of breath, a constant feeling of being on guard. At times like this, not only the mind, but also the body can remain in a state of alert. In that state, it may not be that ketamine doesn't work. Rather, it may be harder for it to take hold. It may be harder for the treatment experience to come together in a stable way. That is what I think may be happening.
Does this connect to the salience network that we discussed in previous episodes?
Yes, it connects. The salience network is central to the function of detecting what is important and what is dangerous, directing attention there, and switching mental modes. That function is not unrelated to the autonomic nervous system or emotional condition. If the body remains in alert mode all the time, this switching function may become overly sensitive and unstable. Then, the changes created by ketamine may be more likely to flow towards anxiety or discomfort, rather than in a direction that comes together as treatment. That is what I think may be happening.
In other words, when the alert mode has settled down somewhat beforehand, ketamine may take hold more easily. Is that the idea?
Exactly. I believe what matters is not only the medication dose, it is also how we prepare the condition before treatment begins. Another important point here is that I am not trying to recommend only one specific method. What is truly important is to regulate tension in the autonomic nervous system and emotions and create a condition where treatment can take hold more easily. That is the idea.
So this is not only about a special procedure, is that correct?
Yes, that is exactly the point. The autonomic nervous system, anxiety, tension, sleep, environment, a sense of safety, preparing these factors before treatment begins. This idea can be applied not only to a specific procedure, but also to the overall setting. That is why I think about this experience in terms of how to create a condition where ketamine can take hold more easily.
For viewers, what is the safest way to understand this?
Today's takeaway is simple. Ketamine is not a treatment where simply giving a dose is all that matters. Especially in people with strong pain or autonomic nervous system problems, the condition before treatment may affect the result. That is the point. So when you visit a clinic, please try to share things such as whether you are sleeping, whether your tension is strong, whether you have palpitations or shortness of breath, whether your anxiety is strong, whether your body feels tense all the time. Please try to communicate these kinds of things as well. It may change the clinical understanding.
Finally, could you summarize today's points?
There are 3 points today. First, ketamine is not a treatment where the same dose always produces the same response. Second, what matters is not only the dose, it is also what condition the person is when treatment begins. Third, what we should truly emphasize is not one specific method itself. It is the idea of how to create a condition where the treatment can take hold more easily.
Thank you. Even with the same ketamine, why do differences appear? Behind those differences, the autonomic nervous system and the condition before treatment may be involved. Today, we discussed the entrance to that topic. Next time, we'll go one step further. Why does the doctor place importance on music, the atmosphere of the room, and even a sense of safety? Simply administering the medication is not enough. We'll talk about set and setting. This channel provides information for a general audience. We cannot respond to individual medical consultations. Thank you for watching today.
Thank you very much.